My name is Petra Nelson, and I work for Nevro, the host of today's presentation, and the medical device company and creator of HFX for the treatment for painful diabetic neuropathy. Before we start, I wanted to reassure everyone, don't worry about trying to take notes on everything that we're discussing today. As a follow-up, we will be sharing a link to the recording of this presentation, along with some key next steps and links for you to be able to learn more, so you can just sit back and listen to the presentation without worrying about taking those notes. Next slide, please. Great. Before we jump in, the top two questions that always come up are, where is this and is it covered by insurance? So we wanted to cover those straight out of the gate. HFX is offered nationwide. There are thousands of doctors experienced with HFX. And you can find a physician near you, but based on your zip code, on our website. Again, we will be providing instructions at the end of the presentation and in the follow-up email, and HFX is covered by all major insurances. Next slide. Great. Dr. Singh will be leading our presentation today. So for a brief introduction, he is the lead interventional pain specialist for the Centers for Advanced Orthopedics based in Maryland, Virginia, and DC area. Previously, he was in the Department of Neurosurgery and has experience working with orthopedic surgeons and neurosurgeons. Dr. Singh has been treating patients with painful neuropathy for the last 10 years. And Dr. Singh focuses on functional-based improvements, such as improving quality of life and improving independence with daily activities. So without further ado, I will hand it over to Dr. Singh.
Petra, thank you so much. And thank you so much to everyone, both who's joined the call today, as well as the team at Nevro HFX. It really is a pleasure to be with all of you this afternoon or this evening, depending on where you are around the country. This is a topic that's very passionate to me, something that I thought was very important right from the beginning of when I started practicing over a dozen years ago. I certainly want to let all the attendees know today, I certainly welcome questions. I think it's really important to make sure that your questions get answered today so that this becomes a valuable experience for you. Obviously, with a lot of HIPAA rules, we may not be able to go into very specific details about you per se, but this could be a starting point where you could then reach out to a local physician, or if you're in the Baltimore, DC region, I'd love to see you and be able to answer your questions one-on-one. So with that, next slide, please. So I think it's really important when we talk about painful diabetic neuropathy to sort of start with a little bit of data and kind of from the beginning. The CDC posted earlier this year that there are over 35, closing in on 40 million patients across the country who have diabetes. And for all of us who unfortunately may consume a little too much processed food or some little extra sugar in our coffee, the numbers of patients with diabetes are certainly going up year after year. And when patients have diabetes, the excess sugar really affects the nerves throughout the entire body. Now, our discussion today is going to focus on the pain in the nerves in our feet, but you may know other individuals who have problems with their GI system or with their eyes that are all related to their diabetes. For those individuals, about half of them will have a painful diabetic neuropathy. And we use the neuropathy term and the painful term medically, but a lot of patients will use numb, tingling, burning, pins and needles, kind of how your foot feels if it falls asleep and it's trying to wake up. But this is 24/7 and throughout the day, and it impacts their quality of life. Another very important statistic that we should know is that almost half of these patients try other alternative treatments, and they don't find really good success. So up until the FDA approval of HFX, patients were stuck, and that's what we saw. And those are the kind of patients that I've been treating. I'll share a quick story because I literally saw a patient about 2 hours ago. And the thing that bothers her the most about her painful neuropathy is that she can't attend family functions. And so you hear these stories, and it's sad as a physician because you want to be able to give patients back the meaning of why we're all here. Next slide, please. So what causes painful diabetic neuropathy? Well, unfortunately, the pancreas, which is this organ inside our body, it releases this substance called insulin. And insulin runs around the blood, and it kind of helps to digest and pick up excess sugar that's running around. When there isn't enough insulin, or when the pancreas isn't working very well, excess sugar runs around in our blood vessels. And so they end up clogging up and damaging the nerves in the eyes and in the heart and the gut, but they also damage the nerves all the way down in our feet. And patients will say, well, both of my feet hurt. And typically, the pain is equal from right to left. And then it'll start in the toes, and then it'll creep its way up into the foot, the ankle, and even into the calf. As I said a little earlier, a lot of these patients don't usually use the word pain. They'll use words like shooting and burning and pins and needles. A lot of patients will say, during the day, it doesn't bother me too much because I'm distracted and walking around, but at nighttime, it's very difficult to fall asleep. Next slide. So what happens when a patient comes to see their physician? Well, we typically start patients on a variety of different treatments and medications, all of which are also FDA approved, just like HFX is. And a lot of patients will try different topical treatments. Nowadays, so many people try the CBD creams or the other over-the-counter creams, including the one you see on the screen called capsaicin. Other medications that they'll take by mouth are things like gabapentin or Lyrica. Unfortunately, both of these medications can cause some memory issues and some weight gain. And that becomes a complaint of patients because even if the medication is helping somewhat, now they're stuck dealing with one of these side effects that you see there. Medications like Cymbalta can cause dizziness and brain fog. The amitriptyline and nortriptyline will cause vivid dreams. And of course, pain medications, or what everyone knows as opioids or narcotics, they're not well designed for patients who have diabetic pain. Unfortunately, because the pain is so bad, we end up using some of these medications, but they're not ever really the first choice. And the side effects of constipation and fatigue become very serious. And then, of course, as everyone knows, we worry about addiction too. Next slide. So what is this new option and how does it work? HFX has been around for over 10 years. And in terms of it being safe, and I'll get to that slide later, it certainly is. But in terms of how it works, I like when patients kind of think of a pacemaker. It's something that, whether you or a family member or a friend may know about. And so when the heart doesn't beat electrically correct, and so the heart can either speed up or slow down, and it's not, and it beats in a funny way, cardiologists will put in a pacemaker and the heart beats normally. And this really helps to save patients' lives and helps patients live a long life. So in a similar way, the sugar that's running around in your bloodstream will end up causing a painful electrical signal that your nerves are feeling in the feet. And what will happen is that signal will go up the body, up through the spinal cord and into the brain. And that's when you tell us, hey, it hurts in my feet. So kind of like how the pacemaker regulates how the electricity of the heart works, HFX regulates how the electricity of the spine works and how the nerves work. And so it very well kind of blocks that pain signal. And so patients quickly are able to see that their pain in their feet go down quite a bit. And both from an HFX perspective, as well as specifically for diabetic neuropathy, the data stretches out well past 10 years in terms of how long these systems have been working for patients. Next slide. So as I mentioned just a moment ago, how safe and proven is the Nevro HFX system. So, spinal cord stimulators have been around since the 1960s. So using a stimulator to help patients is nothing new. And I think a lot of patients do get leery, and hopefully I can reassure everyone tonight who may be leery that this has been around for a long time in medicine. And we're certainly not experimenting with anyone. And the data that we've collected over the last 2 to 3 years is quite impressive. Impressive so much that we went to the FDA and they felt that this should be the first stimulator on the market to have this approval. So I know that Nevro takes great pride in helping patients and in sort of proving the long-term success when using stimulation for pain. Next slide. So I did mention data, didn't I? So not to get too nerdy tonight, but it is important that patients do understand how well this device can work. So what Nevro did is they said, let's look at a whole bunch of patients who have painful diabetic neuropathy. And let's put, half the patients doing the traditional things and half the patients will give them the HFX system. And these patients' pain scores were 7.7. So let's call that pretty close to 8 out of 10. And I know for those of you who are calling in tonight who have painful diabetic neuropathy, I know my patients, their average pain score is pretty close to 8 out of 10. So all these patients were able to get a trial. And then, once the HFX system was working for them, within a few weeks, their pain scores came all the way down to a 2. Patients found that they were sleeping better. Patients found that they were using less of that medication. Patients found that their mood was better. Their families felt that their mood was better. And patients were able to go out and restart enjoying life. So when we did the trial, the other group of patients who didn't get HFX were then offered it after about 6 months. And don't be shocked, but within a few weeks of them getting their HFX treatment, their pain scores were also down at a 2 instead of at an 8. And this improvement has been ongoing now for more than 2 years, which is pretty impressive. If anybody is a bit of a nerd tonight and they do like to read the literature and the research, 2-year data for HFX is pretty impressive. Next slide. So as Peter had mentioned earlier, one of the things that I try to help patients with is really quality of life, right? Sometimes patients don't get pain scores all the way down to 2, but patients are sleeping much better. And everyone knows that when they get a good night's sleep, they're a lot nicer the next day. I know I certainly am. What was really interesting is that a lot of the patients were finding that they could feel their feet a lot better now than before they had the HFX treatment. And there's never been another system on the market where patients have been able, after 6 months, to notice that they're feeling their feet better than without it. And of course, everyone wants to know how happy are patients. Well, 9 out of 10 patients were very happy with their treatment and having had the HFX system for their painful diabetic neuropathy. Next slide. So who is a good candidate? Well, obviously, as the title, sort of states, you got to be diabetic. And most of the patients that were in the trial where we collected all of this data, they had been diabetic for well past 5 years, and some even out past 10 or 12 years of suffering from diabetes. After having the diabetes diagnosis, then you're also diagnosed with painful diabetic neuropathy. So there's some very simple tests that we can do in the office when we meet patients to check your sensation, to see how high up the foot or the calf your neuropathy goes. And then we can ask a lot of questions in terms of whether it's a painful or a painless diabetic neuropathy. And so these kind of help us to figure out what treatments are best for you. So those who are diabetic, those who have painful diabetic neuropathy, and those who have not had success with at least two different kinds of medications. So if you remember, a few minutes ago, one of the slides had showed a whole list of about 7 or 8 different medications. So we do try to offer patients a medication option first. As I said, more than half of these patients don't get great improvement when using those medications. And some of those who do get some improvement, unfortunately, also get some side effects. So if you've got diabetes, if you have a painful diabetic neuropathy, and if you've at least tried 2 different medications, so let's say you've tried Tylenol or ibuprofen, you've tried gabapentin or Lyrica, you've tried tramadol or Cymbalta, so any combination of all of those, then you become a very good candidate for this procedure. Next slide. So then, of course, everyone wants to know, okay, now I'm a great candidate, Dr. Singh, but what is it like to try the HFX system? So my second example for tonight, the first one, if you remember, was the pacemaker example. So the second example I give patients is, think of how you go and buy a car. I'm not sure how everyone on the call tonight does, but when I go buy a car, I definitely go for a test drive, right? So I don't walk in and hand them a check. I say, hey, let me take the car out and see if I like it. And so very similarly, what we can do for patients is that we give them a trial of HFX. So patients go home. Typically, it's somewhere between 7 to 10 days. At least that's for me and my patients. And they get to try it. So I give them the keys to the car, and they take the HFX home. And after about 7 or 10 days, they come back. And so whether they liked it or they didn't like it, we take the test drive back from them. And we let the patients make the decision. And it becomes pretty obvious, right? When a patient comes back and says, I haven't had to take my pain medications. Or they say, I was able to sleep so well. A lot of times, actually, a patient's bed partner will come with them and they'll say, yeah, the patient, he or she, they didn't roll around. They weren't up every hour. They weren't rustling the sheets off of me and off of their feet because of the pain they were in. We encourage patients to, go out to dinner, to go to their kids' soccer game, to go to their grandkids' dance recital, whatever it is that you do on a day-to-day basis that you're not, let me say that again. Whatever it is that you've been wanting to do that you feel you can't because of your diabetic pain, that's what we want you to go do. And that way, when you come back, you really had a true test drive for that full 7 to 10 days. So once that gets done, then we're able to decide on moving forward with the HFX system. And as you can see on the screen, 9 out of 10 people choose to proceed. I would tell you that's pretty close to what my patients also say. When you go through that checklist of, are you a good candidate? And if you really do check off all those boxes, 9 out of 10 patients get success from their HFX trial. Next slide. So, patients like to know, how can I start a conversation with my physician? I think, for those of you who are on the call tonight, The first thing you should know is you're kind of on the cutting edge. You're on the first wave of people who really want to know how they can be helped without adding more drugs, or who can be helped because their medications are causing them side effects. Um, you may actually need to educate your doctor a little bit about this. And, in the follow-up informational packets, we'll be able to help you do that, with your physicians. But I think the first place you should start would be either with your primary care physician or your family doctor, or if you see a podiatrist for your foot care. Both of these are good physicians to start with, and just asking them, hey, are there any other medications I can try? Is there anything else that's out there for me? I attended this presentation. What did they think? Um, there's no such thing as having had it too long, and having had it too short. Well, in those first few months, we try to help patients with medications. But if you've had the painful neuropathy for 3 years, 10 years, 20 years, there is there's no window as to how long you can still be a candidate for. I think what was really impressive when Nevro did the HFX study was that they found that waiting longer just left patients in more pain, and that the sooner patients were able to get an HFX trial, the quicker they were able to improve their quality of life, take a lot less medication, and improve what they want to do, which is go and live, go and tend to the garden, mow the lawn, go out to dinner with friends. So the longer you wait, the longer you wait, unfortunately, the more pain you're going to remain in. Next slide.
Great, thank you, Dr. Singh. So this brings us to our Q&A section. But before we jump in, I didn't know, if you had any additional, kind of patient, your experiences with patients and their journeys that maybe you wanted to share.
Sure. There are two patients that I've recently seen. Both, one was a diabetic painful neuropathy patient. The other one was someone who's got chronic foot pain for a different reason. What's been amazing with both of these patients is after the trial, and after we we gave them the HFX system, they've called back and they've told us how they've been able to do things with their family, right? So one young lady, I say young, but she's in her 70s, but one young lady felt that because of her pain, she was just stuck at home so much. And she's been able to attend, her granddaughter's graduation now because of her HFX system, allowing her to get out of the house and not have to worry about where she is when her foot pain gets out of control. The second patient was a patient who, because of multiple foot surgeries, was actually stuck in a boot, and the only way that she could walk because of the pain was in a boot. And after we did the HFX trial and gave her the HFX system, when she came back to see us about 4 or 5 weeks later, she was walking in sneakers. It's not often when a patient comes in and with tears in their eyes and they want to give a doctor a hug, especially during COVID. Nobody wants to hug anybody. But she was so moved that she can now just wear normal shoes and doesn't have to limp around, wearing a boot because of her foot pain is so much better. So, there are hundreds and thousands of these stories, that Nevro HFX can tell. And my hope is that with answering questions tonight and presenting, the presentation and the slides, is that for those of you who, have been apprehensive or just been a little nervous or scared, to talk to your doctors about it, please don't wait. Um, the way that this has changed my patients' lives, um, they will tell you they shouldn't have waited, even though they did.
Great. Thank you. So now we will open it up to Q&A. So one of the first ones, I know we talked through this a little bit, but that often comes up is what if somebody doesn't have, diabetes? Does this treat other types of neuropathy or other types of pain?
So there are a couple other FDA-approved pain diagnoses for patients. I think this is a situation where you'd want to talk to your family physician and really get in touch with a Nevro HFX physician. And so, Petra and the website can find you a Nevro HFX physician in your area, and they can then go through your specific medical history and be able to offer it to you. Between FDA guidelines and insurance guidelines, it does get a little complicated with different types of neuropathies and other nerve pains. But many are covered, some aren't, and that's a great conversation with a physician who knows how to use HFX.
Great. And this is also in our follow-up email that we will share out. We have HFX for PDN, which is really specifically focused on patients with painful diabetic neuropathy. But we do have another website, and we'll share that link in the follow-up email if you look for that as well. Great. Next question is, will this help with loss of sensation in my foot or feet?
So
Yeah.
in your feet, yeah.
Yeah.
So when it comes to loss of sensation, I guess the follow-up question I would have is, are you having the painful diabetic neuropathy in addition to loss of sensation? So, if you remember from the very beginning of our presentation, half the people have painless diabetic neuropathy and half people have painful diabetic neuropathy. So when we talk about those who have painful diabetic neuropathy, there was a trend in the data where patients did get return of some of their sensation. And now we haven't gone, super geek and figured out all the data points, and we're still following these patients for another couple years. So the trend may actually show that yes, sensation does improve, but we can't officially tell you that it is statistically significant. And I'm sorry, that's kind of a technical word that we use when we do data and we run these trials to figure out if things work. I guess in a more simple term, I would say that there is a chance that your sensation can return. There were other patients whose motor strength got stronger. And there were other patients whose reflexes, when the doctor whacks that thing against your knee in the back of your foot, and then your leg jumps out at you. So those are called reflexes. So some patients had improved reflexes, in addition to improved sensation and in addition to improved motor function. So there's a chance.
Great. Thank you. Next question. I know we talked on this a little bit briefly on one of the slides, but if it was missed of, what if somebody hasn't tried prescription medications yet, or maybe they've only tried one?
So, at the end of the day, this is a discretionary, this is something that you and your physician would talk about in more detail. What I try to do is follow the data, right? I mean, at the end of the day, being a physician is partly being a scientist. And if the science says that patients should at least try 2 different types of medications before trying an HFX system, I think that it's important to at least try it. Now, does that mean you need to try it for 2 years? No, not at all. But we could give it a 4 weeks, 6 weeks, and most medications, a patient will know within the first 4 to 6 weeks if it is helpful, if it's not helpful, or if it's causing a side effect. And so I think it's important to make sure that you sort of dot all the I's, cross all the T's, check all the boxes, because at the end of the day, when you get to the HFX, we all want you to succeed. We all want you to have better pain control. We all want you to have better outcomes in life and go and we hear great stories like attending graduations and not walking with boots anymore. Um, but that's all because those patients also checked all the boxes first. So it doesn't mean you have to wait for 2, 3 years. No, no, no. But to give it a good 4 to 6 weeks, I think is responsible. And then if it doesn't work, great. You've checked all the boxes, and now we can all feel comfortable to go do the trial.
Great. And similar to someone else on kind of on their treatment journey, wondering if they're too late. They, experiencing pain for, more than a couple of years now, but they can no longer, stand or move around without a cane. Is it too late to try HFX?
No, it's never too late. And if there's a take home point for tonight, I hope this is one of them. Many of the patients in the study that Nevro did, they had diabetes for over 10 years, and they had painful neuropathy for almost 5 to 7 years. And these patients, 80% of these patients all had success. Half of the patients had tremendous success. So please don't wait in getting a hold of an HFX physician. Please don't wait in chatting to your podiatrist or your family medicine specialist. We don't want you to suffer. We want you to enjoy the rest of your life.
Right. Thank you. Next question is, what's involved, in the trial phase?
So with the trial phase, and physicians do some of this just a little differently from one to the other, but essentially you'll meet a physician in one of our procedure areas, and we will perform the trial by placing those two electrical wires, and then we sort of tape everything to your back so that you can move around for those 7 to 10 days during the trial. That the trial experience all happens within about an hour or so. The procedure itself is much shorter. During those 7 days, we really ask you to go and do all the things you want to do. Now, there really is one restriction, and that is you can't shower. And all my patients kind of give me a funny look as to why. But, with the device, taped to you, the last thing we want to do is cause an infection. So you can sponge bathe, every morning. We just don't want you to get that dressing wet. And then, you do get paired with one of the Nevro HFX coaches, and they kind of interact with you every day to make sure, that nothing's going wrong, that, you're getting pain relief, and then they can make some adjustments to the trial as you're going through it. And then at the end of the trial, you come back to our office. And then, as we take the tape and the dressing off, the electrical wires easily come out, and they all get discarded. Although some of my patients take a picture of it, it's kind of weird, but for them, I think it's kind of cool. And then, we have a real in-depth conversation as to, how well it helped you, and is this something we want to move forward with?
Great. So if somebody then, wants to move forward, for the longer term, the longer term, solution, what's the recovery period? How long is that recovery period?
That's a great question because, when I talk to patients, about HFX, some of them have had back surgery in the past, or some of them have known friends that have had back surgery. And so when we use the word procedure, a lot of patients automatically think back surgery. And I want to make sure that that's really clear tonight. This is not back surgery at all. This is a procedure that's, that we can do in the operating room. So yes, we do go to the operating room to do it. But all told, it takes about an hour, hour and a half. Patients are asleep the whole time, so no one has to worry about being awake. And they go home the same day. There's no hospitalization. We do these in the outpatient centers all the time. Patients can be sore for probably a good 7 to 10 days. We provide patients some medications for that. We also provide patients antibiotics to make sure that they don't get an infection. That's really important as well. Specifically for diabetic patients, I think one thing that's really important is, for those of you who check your blood sugars and do finger sticks, or nowadays everyone has those monitors that they kind of attach to the outside of their arm. It's really important that, the week before and the 2 weeks after, we do the procedure, that your blood sugars are as tightly controlled as possible. And I can't stress that enough, right? I mean, we have patients whose hemoglobin A1C could be 8, 9, even 10. And we will do the procedure for them because they're going to keep really tight glucose control. And, ideally that's under 150 for, about a good week or two before and a good week or two after. And in doing that, patients, the infection rate is exceedingly low. But yeah, soreness is the big thing. We give you some medications for that. Don't worry. But usually by the time you come back to the office for your first follow-up check, soreness is no longer what patients are talking about. They're excited to get the device turned back on. They're excited to learn, how it all works and to get the pain relief that they had during the trial.
Great, thank you. I'll take the next couple of questions that come up pretty frequently, but still is, how can somebody find a provider offering HFX? So we mentioned this, and we will definitely include, the link in the follow-up email, and we've got a slide coming up with the next steps. But you can locate a provider, experienced with HFX near you by visiting hfxforpdn.com. And right up in the top right corner of the page, there's a Find a Physician button there that you can click. But again, we'll be sending that over email, so don't worry about that. And then, of course, again, will this be covered by my insurance? So, at the very top of the session we covered, but if anybody joined late, HFX is covered by all major insurance plans, including Medicare and Medicare supplemental. And any specific questions related to your coverage or costs. Obviously, those all vary based on, individual plan benefits that somebody might have. And so those are best, to discuss with a provider offering HFX. So along with any of those specific medical, questions you might have of your own medical history and about HFX, going to that provider that's experienced with HFX, they'll also be able to, answer questions about, your own exact coverage as well. Great. Next one, very seasonal question, that has come up is, after any initial, recovery period, can somebody swim with the device?
Oh, absolutely. So, obviously, after the device is placed and we see the patients back in the office, for the first about 2 to 3 months, I do try to have patients not go crazy. That's a very medical technical term. But we don't want you overexerting yourself for the first couple months. And the reason there is, we want to make sure that you're really getting the pain improvement that you had during the trial. So, once that 3-month window hits, I pretty much allow all my patients to do almost anything that they want to. So, once the skin heals really well, patients can certainly get into the pool and walk around. But I try to hold them from swimming, like actual real swimming, for about 3 months. Patients could get into the ocean if you live on one of the coasts or if you got into the lake, but something where you're just sort of walking or wading, not actually, swimming in those first, 2-3 months. Patients have asked about playing golf and playing tennis. They've asked about picking up their grandkids. Again, all these things I have no problem so long as you've made it through the initial recovery period. And that's a good, safe 3-month window. I've had patients asked about scuba diving, and so there is a certain depth that you have to stay to, but you could do that. And even some patients who want to skydive can also do that as well. So what is really nice about this device is that, once you're healed, once it's working well for you, and once you get past 3 months, I actually don't really see these patients but once a year just for a check-in. And that's also really important too, right? I want to know that you're doing well. We don't just put these devices in and walk away. We want to hear these great stories of you, going to the beach or playing with your grandkids or hitting a hole in one. It makes our day exciting too. So,
Great. Much more everyday activity is, can somebody drive with it?
oh yeah, of course. Sorry. Yeah. So driving is something that the HFX system, it allows you to do. And that's actually one of the main reasons that I like using HFX is because we are able to let patients drive on a daily basis. Um, Gosh, boy, that is a pretty easy one that I forgot. Sorry.
Yeah, no, I know. We sometimes wish you couldn't drive until you realize how important it is. Another one is, great question is, how long after the implant will somebody feel relief?
So it can vary, but I usually kind of tell patients, give it a week or two after we start to reactivate the programs. The way we program this is getting a little nuanced. So I don't want to lose anybody on the call, but the way that we program, during the 7 to 10 day trial is slightly different from how we program after you get implanted. And there are some technical reasons for that. It's not a big deal. But the ramp up phase can sometimes take a few extra days when compared to the trial. So a lot of times we tell patients just, be patient for the first couple weeks. As it ramps up, you'll start to notice that you're sleeping better. You'll start to notice that, you don't need the pain medications as often. And you're always kind of dialoguing back and forth with the Nevro HFX coach. I do think, for anyone who is savvy with other stimulators on the market, the Nevro HFX coach is something that only Nevro provides. And so, as a Nevro patient, not just a painful diabetic neuropathy patient, but as a Nevro patient, you get full access to all the bells and whistles that they offer. So, there's a coach who will be in contact with you usually once a week, and they sort of help you, kind of ramp up to where you're getting the ideal pain relief that you're looking for.
Great, thank you. And then, is there any age limit?
I've not yet done a 99-year-old, so if there's a 99-year-old on the call, come see me. Obviously these are for adults, right? So, individuals 18 and older. That doesn't mean someone a little younger couldn't be considered, but again, that's something you want to talk to your physician about. But no, there really is no age limit. At the end of the day, the limits are going to be medical safety, right? So, we want to always make sure that whatever we do, whether it's giving you a medication, sending you to therapy, or trying out the HFX system, are you medically safe for this? So some other things that we look into, but are not deal breakers would be, things like your heart function, if you're on a blood thinner. Those are sort of the big ones. Obviously, if you're, getting any active cancer treatment, it's kind of not a smart idea to be doing, a stimulator in that scenario if you're getting active treatment. Trying to think what else. Those are the big ones,
Yeah.
especially, the blood thinner is the big one. And there are a lot of workarounds. And I have done a lot of HFX for patients who have blood thinners, things like Coumadin or warfarin, clopidogrel, Plavix, Eliquis, just to name a few. So they don't stop us, but it's a small little hurdle that we'll work out together along the way.
Great. One more that has come up is how long, is this designed to last for?
So there are two answers to the question. The first answer, so we talked about earlier, right, that there were these two electrical wires and then a battery that sort of runs the system. So the two electrical wires are designed to remain inside of you as long as you continue to use the device. So there are plenty of patients around the world who have had stimulators implanted back in the 70s and 80s and 90s, and their wires are still in them as long as they're still using their device. The battery is the part of the device that does have an age range, if you will. So usually for the HFX system, you're looking at about a 10 to 12-year window. And so, after about 10 or 12 years, the battery life kind of, decreases. So for those of you who have cell phones, you know that after a while, the battery charge on your cell phone just isn't the same. And so you go to, Apple or Google and you get a new cell phone. So similarly, after about 10 or 12 years, we can replace the battery. It's a very simple procedure, takes about 15, 20 minutes. And you take the old one out, you plug the new one in, and off you go.
Great. So I am not saying more new ones come in, but I did just want to queue up, in your own experience, right? Are there any other questions that you get regularly from your patients?
I think the biggest question I get is how certain am I that it's going to work? And sometimes a lot of my patients will get very fixated on the second part, and the battery and putting it in, and they don't necessarily focus on the trial itself. The trial answers the question, how well is this going to work? Right. So, if a patient does the trial and they get about 50 or 60% pain relief, well, then if we implant the device, you'll get 50 or 60% pain relief. If the patient gets 80 or 90% during the trial, they should get 80 or 90%, after we put the device in as well. So I think the trial, being something that I kind of tell patients, it's a no harm, no foul experience. It is exceedingly safe to do a trial of an HFX. And after the trial is over, everything comes out. So a patient could come back and say, Dr. Singh, I'm sorry, but I don't think that this thing worked. And I tell the patient, well, I'm sorry that it didn't work, but there's nothing left behind you, right? If patients who have had spine surgery that hasn't worked, well, unfortunately, now they've got rods and screws stuck inside of them. They can't, then they don't come out. So it's very different. Patients think that this is like a spine surgery experience, and it absolutely isn't. And most patients, I really try to tell them, focus on the trial, see how that works for you. And if that works, then you're a great candidate.
Great. Thank you. And I think we are ready to wrap up the Q&A portion of this. Michael, if you want to hit the next slide. So I know we have throughout this said that we would, we will, definitely will be sending you the email with these follow-ups and information, but just to kind of walk through of, okay, at a high level, what are the next steps? The first thing would be is if you haven't already, you can visit hfxforpdn.com and answer a few questions to see, if this you could be a good candidate for this at this time. And as Dr. Singh mentioned earlier, right, maybe if you haven't tried prescription medications, yet, that's speaking with a physician. If it looks like you are a good candidate at this time, then at the end of that, answering those questions, you'll have the opportunity to provide your phone number. And you can do that so that you can request an HFX coach be assigned, personally to you, and they can answer all your, any questions, that you have. And they'll actually also, they'll be able to facilitate and help you also find a physician, near you as well. When you take that assessment online, right away we'll be emailing to you at the address that you gave a discussion guide. And you can take that if you, say that you want to either go straight and find a, pain management physician experienced with HFX, or maybe you want to talk to your primary care physician first, you can use that discussion guide, to learn a little bit more about HFX and also help you start that conversation, with your doctor. If you are ready to find a physician experience with HFX, again, that's on the website hfxforpdn.com. Right in the top right corner, there's a Find a Physician button. You can click on that. You'll be able to enter your zip code, search, and choose the one that's nearest you. And when you there's contact information there, phone number, it has the address for the physicians. But when you call them, if there's one that you find that you would like to visit, you'll just want to ask for a Nevro HFX consultation. And that wraps us up for today. Michael, if you want to go to the last slide, I just wanted to thank you so much, Dr. Singh, for your time, especially for going through all the really great questions that we received. And a big thank you also to all of our attendees and your participation in the questions, which really make this, I think, a really valuable experience for everyone.
Thank you so much, Petra. And again, thank you to the whole Nevro team. But as you said, real thanks to everyone who tuned in this afternoon and this evening. I hope we've answered all your questions and happy to keep the conversation going in the future.